this is the session that's Doing It Yourself Together, Orchestrating Grassroots Movements. And it's a discussion and some conversation about four known maker advocacy organizations. We have the Fab Foundation, and Sherry Lassiter is here to represent Fab Foundation. Nation of Makers, that's Dorothy is here, Dorothy Jones-Davis for Nation of Makers. And then we have Open Source Medical Supplies, and that's myself, Sabrina Merlot, and Molly Rubenstein from OSMS. And we have also Tikkun Olam Makers with Edun Silla. And we are going to chat a little bit about our experience facilitating, witnessing, supporting our communities as they've really just killed it in terms of the response to COVID-19. And so why don't I go ahead and just pass the baton here. I'm gonna go left to right in my screen, but I'm gonna spotlight you, Dorothy, and then you could give us a little bit of background about yourself and Nation of Makers, and just help us with a little orientation.
Sure. So my name again is Dorothy Jones-Davis. I'm the Executive Director of Nation of Makers, and we're a national organization, slowly becoming international, but started here in the US, that serves as sort of an association for maker organizations. And so we support organizations that are touching the maker movement in different ways. The three big buckets are community building, bringing people together, partnership development, and the like, resource sharing. So we try to share and spotlight organizations that are doing really great work. These can be stand-up organizations that have just been stood up as in a pop-up manner, or these can be long-standing organizations and groups. And then we do advocacy. So we're based in the DC area in the United States. And so because of that, we see a role that we play in policy and shaping policy and being advocates for the maker movement, increase funding, increase support for the maker movement from both federal and local entities. So that's pretty much us in a nutshell, and we've continued to do our work with COVID and shifted, and I think we're going to talk about that in a little bit, so I'll just stop there and let my colleagues also tell their introduction. Oh, Sabrina, you are
unmute. Sherry, why don't you take the stage here?
All right, if you don't mind, I'm gonna share my screen here really briefly. So hi, I'm FabLab. I help coordinate the global FabLab network. We are a community of about 2,000 labs in about 125 countries. And we all share sort of the same tools and processes, mostly organized around digital fabrication. Just to underline what Sabrina said, boy, has the community, the maker community and the FabLab community, all of us together have just knocked it out of the park. It is so impressive, and it is so humbling to see how we've responded in this world. So basically, we were formed in 2009, to support the growth of the global FabLab network, but really to provide resources and help labs reach their potential and make the most social impact that they possibly can. So what we really try to do is provide opportunity through digital fabrication and technology tools. And just thinking about these networks, right? If you add all the maker spaces and Fab Labs and hacker spaces and innovation hubs around the world, we're probably talking about a global infrastructure of more than 6,000 or 7,000 or 8,000 spaces, and that was just that was the count a couple of years ago. And so we have this amazing infrastructure amongst all of us to make impact on education and in terms of business opportunity, and what we've just proved or just proving is with local resilience for things like COVID response. And similar to what Dorothy was saying, we do a lot of public-private partnerships. We work with the National Governors Association. We're working on a National Fab Lab and Maker Network Act to sort of enable this in communities all over all over the United States. And we work with large corporate partners to build infrastructure and to build resources. So that's kind of what we do. And specifically for COVID-19, we're providing PPE, especially to Native American communities throughout the country. We have local collaborations with Fab at CIC. I think Julia's on, and with Artisans Asylum, which is Molly's older, former organization. But I think we have a few amazing makers that are a whole bunch of amazing makers that are making PPE around the country. And then we're doing fiscal sponsorships for PPE related projects, but we're doing it for free. So that's another sort of service that we're providing to the community. And then, of course, here are some of our partners, Nation of Makers, Shift 7, OSMS, and Tom. Actually, I don't have Tom on here. And then just last but not least, in terms of COVID, we have a big repository that is partially comes from work being vetted by MIT, and also partially from the community. So if you're looking for resources, that's that. So with that, I'm going to turn it back to who? Molly, Tom, Sabrina?
Let's go to Molly.
Hi, all. I'm Molly Rubenstein. And unlike Sherry and Dorothy, the initiative that I'm working with, Open Source Medical Supplies, doesn't predate COVID-19. So I co-lead Open Source Medical Supplies with Guy Cavalcanti. We previously ran a makerspace together called Artisans Asylum that Lass just referenced almost 10 years ago. Actually, 10 years ago, this month, it was founded. And spent some years training other people to create makerspaces, community innovation spaces around the world. We started Open Source Medical Supplies. Guy was the one who initiated it when he saw supply chains shutting down around his robotics business. But it was immediately opened to be an open platform for makers, medical professionals, and local community organizers around the world to work together to coordinate, to find high quality information about how best to respond to the COVID-19 supply needs in their local communities. So Open Source Medical Supplies aggregates information about high quality designs that have been validated by medical institutions, sometimes actually doing some matchmaking between designs that we see having a lot of promise and medical institutions who are looking to take on that risk of trying to find an alternative to their traditional supply chain. We also offer information about the design requirements for many different items of prevention and treatment supplies. And through the work that Sabrina leads, also work closely together with these local organizers to think about who do they need to talk to in order to do this work effectively. What's the order of operations? How do they make sure that the supplies that are being made by local makers are actually the most important thing needed by the local institutions, and that they'll be accepted by those local institutions and not just have to be thrown out in bulk. So we were formed a little over 2 months ago. We're now hosted by Resolve, to whom we're very grateful for allowing us to exist formally. Our team of 14 works with volunteers in 70 different countries around the world. And our medical supplies guide, medical and community supplies guide, currently has information about 20 different types of supplies, including over 90 different validated open source designs. So we're excited to be here with everybody and have been really excited to work closely with Nation of Makers and Fab Foundation and Tikkun Olam Makers, among others, in order to ourselves be good ecosystem players and coordinate and make sure that the value that we're providing is complementary and coordinated with the other efforts of these other institutions around the world.
Thank you. Adrian, you want to take it away?
Sure. So hi, everyone. My name is Zidan Sela. I'm the CEO of TOM. TOM stands for Tikkun Olam Makers. Tikkun Olam is a Jewish value that translates from Hebrew to English as repairing the world. And makers is because we're leveraging making and makers in what we do. So we were established 5 years ago, and we're originated in Israel. And what we try to come up with is a process and a platform to address the big societal challenges that we saw in Israel, but really is global, and that a lot of people currently don't have basic access to their needs, either because the price point is too high, so cannot afford it, or they represent such a small target audience, there's no viable business or service around what they need. So what we try to do really is to create something that will address this in a way that is not only local, but global. And so what we're doing is inspiring and supporting a global network of communities that are both creating and disseminating affordable solutions for people with disability and the elderly. That was our focus, because these two populations, again, on a global scale, oftentimes don't have access to what they need. And we believe that leveraging the maker movement and making in general can actually allow them access to products or services that they currently don't have. And the big idea was to create a website at tomglobal.org that will house all these open source solutions on the website, both prototypes and vetted products, so people can download around the world, download these specs and manufacture them locally. So, a few weeks ago when we all faced this emerging crisis around COVID, we realized that we need to mobilize our communities in order to address some of these big societal challenges that we see, and specifically around PPE. And so on our website, we created a designated page that curated a lot of the different open source solutions that we saw around us. And also we mobilize our global network in order to create these PPEs and essentially distribute them locally. And this amazing network of makers, not only of course affiliated with Tom, but just in general, kind of took it upon themselves to find these solutions, find the needs around them, not only in hospitals, but also nursing homes, special education, and institution rehabilitation centers, and deliver these PPEs really at scale. And so even though we, predated COVID, and now we're also trying to figure out what we want to do in these coming months, we saw that our network around us and other amazing organizations really responded in a really rapid way, and kind of filled the void and gap that we all experienced and still experiencing to some degree.
Thank you.
Vladimir is bombing us, it looks like.
Apparently.
Hey, Vladimir.
There we go. I overruled Vladimir in Moscow right there. My name is Sabrina Merlot, and I'm not gonna, I am Molly's colleague here over in local response at Open Source Medical Supplies. And I, like Molly said, we came into existence recently, so maybe I can kick off the section of this conversation that's going to cap up or gather comments from the others about how they pivoted, their organizations may have pivoted around their response to COVID-19 and in terms of facilitating the community. I am working with many groups, a combination of groups that existed previously, like the communities that Sherry and Dorothy represent, but also hundreds of groups that stood up through, many of whom through just digital representations, forums, Facebook groups, to manage distributed manufacturing efforts to help with the PPE and medical device challenges. And at OSMS, we came up with a few methods of doing that. We have a sort of building a community of practice through various forums to hold the discussions and to distill best practices. We have a local response guide to help people get up and going around standing up these efforts. And we do sort of ongoing case study documentation and data portraits of this effort to support well, we'll see how it evolves, and we'll get into that conversation later. But that gives you a little bit of sense of how local response, our mission and our focus, some of the range of our activities. So I'll open this up to the panel. I think, Dorothy, you didn't quite get into conversation about what Nation of Makers has been doing, recently.
Yeah, so I can talk a little bit about our COVID effort. So like everyone else, we've kind of pivoted to working and doing our support specifically as it relates to COVID. And we've done this in a few different ways, but most of them are through partnerships. So, again, Nation of Makers really serves to support, but we do that, we execute that support through large scale partnerships with a bunch of different entities around the world. And in this case, just like everybody else, when COVID happened and started, we saw makers rising to the occasion. As Dale has said, Plan C went into action and everybody just started going and doing things. And we saw that there was a need, a little bit of a need to help, collate and coordinate, not necessarily coordinate, but collate sort of what was going on. So we really got engaged in conversation with a number of different groups, including the open source medical supplies group, and getting engaged with that community, as well as helpful engineering, and just sort of we're listening, so for the first few days, there was a lot of listening of what is everybody doing. And then one of the things that we were hearing is people were making lots of designs, people were iterating, makers were producing, but it wasn't clear what was, sort of the right thing to do. And one of the things that happened was the open source medical supplies group started, had been validating and reviewing different designs. And so we were like, okay, we want to help you get that out to the rest of the makers, because they're emailing us and saying, like, where are these designs, right? So we pointed them to open source medical supplies group, but then we also got to meet a group called Get Us PPE. And this group was actually started by a physician, and that physician, or two physicians actually I think it's three physicians started it. They keep growing. Physicians started it because there was a need for PPE at their hospitals. And so we really wanted to make sure that we were supporting through the entire continuum, from the design all the way to the production to the delivery. But we know that delivery is not really Nation of Makers' wheelhouse. So again, we needed to do this through partnership. And so in discussing with Get Us PPE, we worked with the open source medical supplies group and developed basically Get Us PPE Makers, which on their website, they have a section which we help manage, which takes designs that have been validated from sources like the open source medical supplies group, as well as some from NIH or the VA that have already been vetted in some way. And in addition, some other hospital care systems that have started to validate certain designs of their own, put those up in an open source manner so people can have access to them. We also decided to give some guidance to supplies, because we realized that some folks were having trouble finding supplies. So we realized we could be a neutral broker in some ways to help people identify suppliers. And then we also wanted to wear the cap of trying to help people find funding. And we're still very much working on that, because we realized that lots of makers put in their time and effort without any sort of compensation. So we're trying to figure out ways to do that. So we partnered with that group, but we've also been partnering, and you'll hear a little bit about this later, with a group called Find the Masks. And that group is actually a mapping group. So they have a map. And so one of the things we thought that would be helpful would be to create a map of all the maker efforts, the suppliers, the manufacturers. And so we've been creating with them findthemakers.com, which is just a portal. And we've been doing this now in partnership with this coalition, as you'll hear about later. So I won't spend too much time on that, but we've been really trying to work on these partnerships. That's really what our sweet spot is, and really what we've been engaged in trying to bring to the maker community, is new partners that can help us do the work that we're already doing.
Nice.
Great. Well, I think, is anybody else of the panelists want to share a little bit more about what is current, other than that they did? Anything to add?
One thing that we hadn't mentioned, which I think has been an important piece of the storytelling, is that starting 9 weeks ago, part of the team at Open Source Medical Supplies started doing a weekly count, which I actually wouldn't be surprised if many of you on this call have participated in at some point. So we've been trying to aggregate the full picture of what is this global maker, fabricator, small scale manufacturer community doing in response to this crisis. And of course, what we're able to capture is, I'm sure, a fraction of the whole. But in the first 8 weeks, more than 8.7 million items of COVID-19 related supplies have been documented, delivered by these local grassroots manufacturers and fabricators in their communities. And it's been fascinating to watch the arc of that. It tells a story both of the incredible capacity of the makers, but it's also starting to tell the story of how is this picture beginning to shift as we get into month 3, 4 of this crisis, and start to figure out what's coming next.
Great.
Could I just throw in one thing?
Yeah.
Would that be all right? So one of the things that we're thinking about, especially in light of what Molly just said, is, you know, even though, say, in the US or in Europe, the numbers are going down, there are other places in the world where the numbers are going up, right? Where the numbers of infections, et cetera, are going up. And many of those places are equally unprepared, if not less prepared than even we were, right? And so there are organizations that are very, very looking at the maker movement and at, you know, at this kind of distributed manufacturing to see how, you know, they can supply the millions and millions of PPE that are needed in the community, right? Are needed around the world. And so, you know, when we talk about the fact that we can make 8 million of something, you know, as a global community, that's awesome. But we're talking about places that need 30 million a month of stuff, right? You know, when you look at it much more globally. And so it seems that what's happening is that regional networks are becoming even more important. So regional networks of makers and fab labs and hackerspaces, et cetera, are becoming extremely important. And then so how we connect those and how we help support those as they supply the local need is going to be super, super important going forward. And I think that's probably one of the things that we'll think and talk a lot about. So sorry, yeah, go ahead.
That has been, I just want to share, I completely share that point of view with you, and that it's an interesting aspect of supporting these groups because the dominant and the important stuff is happening locally. The information is local, designs are local, response is local, and as organizations supporting and representing these groups, I wonder if we can start and have a little bit of conversation about what it means to become a coalition in support of these efforts that are very local. If we are umbrella organizations across these groups, and you know, I don't know if anybody wants to share some thoughts about coalition building and some of our goals, or this is very new, as we know, but I think we have some sort of consensus already around policy, storytelling, documentation, case studies, and other thoughts around fundraising. So maybe we could get into a little bit about this question of, for example, policy or preparing for policy. And I don't know if you.
Well, if I could throw in something, I was gonna set up Eden because he's like so amazing, but let me just show you something that we saw this morning. So when you think about policy, it's been very interesting to watch this around the world, because in places, you know, in other places, governments have come in and really thought about this and really supported the maker movement. Whereas, say, in the US or in, you know, maybe Europe, you know, there's been a sort of skepticism about how the maker movement and distributed manufacturing can help. And we have seen, you know, like across South Asia, you know, how governments, or even even in South America, how government support and policy can be really, really important. And Israel, which I think Eden will talk about. But, you know, when you really kind of think about policy needs, you know, there's kind of the national level policy, which certainly in the United States was kind of a huge failure to start with. But where it's really happening is at the state level. And if we could figure out how to support the state level and or local level, I think we would be doing a huge service, right, to the community. So how do we help support them? And there are different ways that we need sort of to think about policy. You know, you need to think about it in a regulatory fashion, so the safety of it. But you also have to think about the manufacturing. As we've seen, centralized manufacturing has totally failed at the beginning, right? And now they're just now starting to catch up. So what does that mean, right? And how can we help those initial phases when large scale manufacturing just isn't going to meet the need, and or, you know, and or what happens after, which is, I think, was one of your questions. And then the sort of idea of equitable access. So every large hospital, you know, at least in the United States, you know, their needs are being met for PPE. But what about the nursing homes? And what about the police department? And what about like all the small organizations or prisons, or, you know, or the small organizations that cannot compete for, you know, both monetarily and time-wise for PPE. And I just wanted to show you this graph. This was from this morning. There was a session that was sort of a wrap-up of internationally kind of response to, you know, maker response to PPE. And this is a beautiful graph by Nishtha, who's from FabLab Chandigarh in India. And what she's showing in the top part of the graph, this is the maker response across Southeast Asia, or South Asia, where the volume was very low, but it went up. The maker spaces made PPE very quickly to meet demand, and they met it for quite a while, for several months. And now that the production of PPE is going down, whereas the bottom graph is are the large scale manufacturers who couldn't meet demand at all until about halfway through the response. And now, only now, are they able to meet at scale. And so this is, we see this playing out everywhere. And it's really, really interesting just to think about in terms of the maker movement, and how we can add resilience and or respond in a situation like that. So, but all of that is to set up and say that Eden and Tom, which we call you, your group for short, you know, has done an extraordinary job of kind of igniting sort of a government response in Israel. And so I don't know if you'd like to talk about this, because you're doing great work, Eden.
Thank you very much, Yuri. Great. So, Sabrina, just to your point about building a coalition, I think it's, you know, it's really important to say that we're working with different organizations across the world. And also when I say we, it's really kind of the royal we, right? It's all of us, a lot of different organizations, and you know, we call them Tom communities. So organizations and individuals who are affiliated with us and doing the work locally are responding to local needs, and their local, you know, in their language with their local nuances. It's really important because, you know, the needs at the end of the day in Mexico City are quite different than the needs maybe in New York, and different than needs in Cape Town, and so on. So in terms of empowering these organizations and individuals, we, again, as a group, we need to come up with ways in which we can give them everything that they need. And that's why when we started to kind of looking at the response around COVID, we looked around us, meaning Tom, seeing other organizations that both doing amazing work on the national level and also on really international level, and see how we can come up together in order to learn from each other, share best practices, and also kind of start thinking together about what we're doing now and what, you know, we need to do moving forward, because this is, you know, this situation is here to stay for the at least near term. So whatever we can create in terms of playbooks or know-how that we can share, then other people can take it upon themselves to execute it with the adjustments, because as I said, it's not a copy-paste model. So one of the things that we kind of took upon ourselves was, because our team is both in the US, I'm based in New York, and we have a team in Israel. And so we wanted to start thinking in Israel, because it's a relatively small country and things are to some degree centralized, is thinking how we can also have a top-down approach, right? Because a lot of the things that we at Tom did was really grassroots, bottom-up, individual makers, maker spaces, small organizations coming together and just getting stuff done. But we saw also in Israel that if you complement this bottom-up approach with top-down, you can actually get a lot done. And we tried to crystallize this kind of model, or at least some guidelines to governments. And again, you see the difference, right? Because for those who don't know, Israel is a small country. It's not a federal system. In the US, you have municipal, you have the state, you have federal. So in Israel, it's a bit different. But the idea was, if you have this amazing grassroots movement, how do you, as a government, kind of coordinate this effort in a way that is efficient, right? So if you have you have a great group of makers in a big city, how do you activate them so they can actually be effective also in more rural areas? How do you mobilize a response not only around big cities or hospitals, but also around nursing homes, rehabilitation centers, and so on? So what we did was we crystallized a very basic model with guidelines in terms of the different task forces that we saw that worked in Israel in order to kind of coordinate this effort. In Israel specifically, some of these efforts were coordinated by the Prime Minister's office. But really the secret was this combination of top-down and bottom-up response, where the makers to some degree took the lead, and then the government responded, and that they tried to make this more efficient. And I think to some degree also all of our organizations are trying to do the same, in which we're kind of trying to come together to find out how we can help and mobilize our communities in a way that is more efficient and effective. I do want to also add, not only around government, but another thing that we saw as a very promising kind of top-down, bottom-up thing was universities. Because we saw that a lot of universities has maker spaces. They have manufacturing capabilities. They have a lot of students, even though most of the campuses were closed. Still, students were, some universities allowed access to the different universities in order to manufacture PPE. So if you actually mobilize on a grassroots level, meaning the students are coming in, or people around the community are coming into the university to leverage maker spaces, and you have other, the presidents and other administrators who are supporting this work, you can actually, again, complement a lot of the other grassroots efforts that are happening. And so kind of to recap what I said, the big idea that we had is, if you can complement the bottom-up approach that is happening all around us with a top-down, and create some sort of guidelines that are applying to some degree to other places around the world, then in our view, you can be more effective in your response. And we saw that in Israel, not only because that effort succeeded, but to some degree, Israel was able to flatten the curve and complement a very efficient grassroots response with also a coordinated effort that was led by government and other organizations that had a significant reach.
I want to follow up on that, Sabrina, if that's okay. Just to tie some of the things that Idan just said back to your kind of broader framed question of why form a coalition, what does it mean to do, and bring that back a little bit also to what we were thinking about and kind of laughing about as we created the title for this session, which is, we all have years of experience trying to organize and orchestrate the work of people who are ultimately doing it themselves. It's a DIY movement, and there is a real important distinction to that, which is, we have to figure out as orchestrators and organizers, how do we honor that independence, and how do we empower that independence and not constrain it? So how do we, in channeling the aggregate power of this community, not become a bureaucracy that then actually stifles exactly the kind of energy that we're trying to support? And so that's something that I think each one of us has different ways of doing. And I think for open source medical supplies, there's a lot of this balance between incredibly open platforms like our Facebook group, which has almost 74,000 members, and which we do have some light moderation on, but mostly it's just an open forum for people to share. And then we have, a Slack channel, which has 450 members, which is, a somewhat more constrained, people who are dedicated to the work, for whom we want to provide a platform for collaboration, which we're even still figuring out what the proper parameters of that are. We have our new professional team of just over a dozen. And then we have things like this coalition, which is just a few key leaders of institutions. And we find it's incredibly important to have that full range in order to make sure not only that people are free to have that independence, but that innovation is then able to inform the strategy all the way up that chain to the top level. So, the reason why all of us are trying to do this together is because we are in a position as a group of leaders to be able to push forward policy, to try and influence lawmakers, to try and influence funders, and tell this aggregate story of the potential impact of all of these makers together that could have to incentivize funding programs that would then, of course, have to trickle down back to all of these individual places, but that's not going to be direct. There are going to need to be intermediaries. But how do we do that in a way to make sure that when we're giving recommendations to funders, when we're giving recommendations to government, those recommendations are actually based on the real life experiences of the groups on the ground? And so that's where Sabrina's work is so important, it's not even so much about providing guidance to the local groups, although of course we do that. We try to aggregate best practice across them and then share that back out, but to learn from all of you and the work that you're doing and the work that the makers are doing on the ground, so that as we're designing these policies and strategies, it actually responds to the real life experiences. And that's one of the hardest things that we do, is how do we just manage that information flow and navigate all of, help us to surface and highlight the work that's going on among thousands and thousands of people to pick out those pieces that we can then leverage at that strategic level. So just wanted to acknowledge that kind of as a tension and a challenge, but also kind of the ultimate goal of this group of people as we've come together.
And I think, Molly, one of the things that, to pick up on that, I think one of the things that we are doing is that storytelling, right? So I think, each individual group has sort of a bunch of groups underneath it. And that's sort of a very simple way of saying it, because there is tremendous overlap across our groups as well. But I think there are just a lot of people that we have interaction with, that we may have, engagement with, that we may be partnered with. And I think it's, how do you tell this greater story, right? So, I mean, one of the reasons why this coalition is so important to me is I realize that all of you that are out there doing stuff, if you've made PPE, you're doing. You don't have time to really think about how you're going to do it exactly. Just, you're just, I'm going to do this. This is my design. This is my process. This is my endpoint. You may have given some thought about who am I partnered with to get it delivered to where it needs to go. But you're the heart of this movement and what we're doing, right? So you're the answer. And so in that, I realize that it's a luxury for me to be able to take a step back and look from this sort of 10,000 foot view with colleagues from similar organizations that are doing the same thing. And for us to say, okay, collectively in this really large aggregate now, so each of us has an aggregate of our folks, and then that larger aggregate, well, where do we start to see overlaps? And the first meeting we had together, that was one of the things we started to do, is sort of saying, like, how are we going to map out what's going on and what's the important story that we're trying to tell? What's the story that makes sense? So, when Sherry's in a room with the NGA, the National Governors Association, what do we say? How do we get across what our value is? How do we make, them understand the work that we're doing? How do we make them understand the work we're not doing and what's acceptable and what's not acceptable, right? So we already have had, conversations. I know Nation of Makers has them in several of the other organizations about, we're working really hard, and some folks folks think it's acceptable to never pay makers. That's not acceptable for anyone on this coalition. So we're working on those types of things and trying to tell those stories. And so I think, you know, through the case studies of what we're doing, through telling your stories, having the forum like the Open Source Medical Supplies Facebook group, where you can share not just your numbers, but your stories and your pictures of what exactly you're doing, allows us to have the ammunition to go out there and make that case of, did you know? And every time I present the data that's coming out of OSMS, every week that I share that, people are like flabbergasted. And I'm like, this is underreporting. This is actually, I can tell you for sure this is underreporting. We're not touching everybody here. But this underreporting number is so high, and the stories are so remarkable that you're compelled, right? So I think that's something that's beautiful about bringing together groups. And you might say, okay, well, you're already doing all these things, like why would you come together? But for me, a lot of it is in the storytelling and coalition of our, and compilation of what we're doing together, so that we can make that case for things like policy, so that we can listen to what you're saying, hear what you're going through, and help you continue to do the work you're doing. Because honestly, it's okay. I don't want you to stop making and think about policy. I want to have policy move so smoothly that you're like, wow, I feel really supported in what I love doing. So that's kind of my take on it. Yeah.
I think one of the first things in terms of that case study building is the coalition local response map is in progress. So I like Dorothy in terms of the mapping effort that she was doing. OSMS was also engaged in tracking these groups and registering local response groups. So our first effort is in this open source medical supplies roster. And as a coalition, basically we're intending to pool our, let me grab this, we're intending to pool our portrait of this ecosystem into the Find the Makers map. So the OSMS roster has now been dovetailed into the findthemakers.com map, along with the Nation of Makers database. And I think forthcoming is Tom and the Fab Foundation's ecosystem, at least in terms of the folks that are representing as being involved in local response efforts. So Sherry, I know the Fab Foundation just recently did a survey of the Fab Academy locations, specifically, not the whole Fab network, but just the first 65. And maybe you could share a little bit with us what you found.
Sure. This is in response again to potential regional manufacturing, distributed manufacturing efforts. So as I said, there's some large organizations that have approached us and said, how can we do this better? The supply chains are broken. We have more need. We're going to have more need probably for the next year. And so we're thinking about, okay, who's manufacturing, or at a small scale or a large scale, and how are they doing it, et cetera. And so we sent out to our 65 nodes for Fab Academy. So Fab Academy is a pretty highly technical course that we run around the world. It's a distributed, advanced technical education course, basically. And those labs we know have a fair amount of, they share similar technologies, digital fabrication technologies in their labs, and we know that they have, really technically astute people who are running them. So we said, why don't we just start there and see? And so there's 65 of those labs. And let me show you, let me share and show you, this is literally just this morning, we've got this information. So we surveyed 65 labs. We got 41 responses, which is pretty darn good. We're so excited about that. 31 of those labs are making PPE at their lab. So they're open and at least for COVID emergency. And 4 are making through distributed networks of makers. About 50% are using volunteers to help make the PPE. Most of what's being made, let me go back here. Most of what's being made are face shields, as you probably would assume. 28 of the sites have face shields, gowns, surgical masks, respirators, and all sorts of other things. And so for the most part, it's like level 1 PVE, but there is some higher level, higher threshold PPE being made as well. Supply chain issues. Most of the labs seem to be able to get, or at least half the labs seem to be able to get their materials from state suppliers or available locally, that sort of thing. But a lot aren't. About 15 or so aren't. And what they're doing is they're using something else they had on hand, hacking together different parts and modifying their design to make do. So that's kind of painful because those are not necessarily approved materials, et cetera, et cetera. So you can see how some of those issues come into play. We asked for every product, but in this case, we're using shields, face shields produced in a month. They varied from 120 in a lab to 29,700 in a single lab, which is amazing and very much related to the local context of need and capability, right? Quality control, there is no real good quality control, systemic quality control that people are using. They're using everything they can think of, just using good materials that are approved, feedback from users, that kind of thing. So none of the labs are making money on this, and it's not even clear that they're covering all of their costs. So we asked them if they're providing at cost or donating. 30 of those labs are donating. They're doing it for free. And 12 of those labs are doing it at cost, which usually means just the cost of materials. It doesn't usually cover labor or rent or any of that. The distribution is very interesting. It's ground delivery or personal delivery. That's really how it's happening. Customers are 85% have been hospitals, and the rest have been, as we said before, like nursing homes, schools, doctors, dentists, those, even the Army. I thought that was pretty an interesting one, and City Hall. The products reviewed, very few are being reviewed at a national level, so or like a FDA type approval, and most of them are being done by the local healthcare or the local organizations themselves. They'll test them, and give feedback and say, yes, we will use them, or we will not. And related to that, I didn't put this in here, but the legal disclaimers, right, that go along with it. Probably 24 of those 41 labs do have a legal disclaimer that says, use this at your own risk. Anything that you make, you can use it as long as you can't have access to nationally approved or certified designs, right? And so, very, very interesting. But what it really points to for us is that this local and regional. This is a huge contribution locally and regionally. And what we also are concerned about now, as we kind of turn the page, where we're starting to see surplus production in certain labs and areas, and trying to figure out how do we match the surplus to the scarcity, to the places that have scarcity. And so we'll probably now that we've done these first ones, probably in the next week or so, we'll distribute this survey more widely to Fab Labs and makerspaces everywhere. This was kind of just a sample testing, but the results are, we thought, pretty interesting. So thanks.
Great. OSMS is also going back and doing sort of reaching back out with survey data or questions. So I want to encourage the audience at this point, if they have thoughts and questions, to please put them in chat. We'd love to share this spotlight video with you as well. You can turn on your video. And I also want to invite the panelists to say anything, to add anything to their thoughts around the potential for collaboration and our purpose as a coalition.
I just want to say one last thing, Sabrina, is that for us at TOM, it really helped us crystallize our value proposition, value added. Looking at the amazing work that other organization is doing is, one, humbling, and two, allows us to focus on where we think that we can make the impact, and then kind of making sure that if we are not the right place for either makers or interested or institutions, then we can connect them to the relevant organization, because it really is a team effort and on a global scale. And for us, this coalition was a way to kind of complement each other to a degree. And we're very excited about this because we already see that if we share more resources with our communities, this is something that they really value. And at the end of the day, that is what we're here for, right? To bring value to our community, share know-how. So these kind of relationship cultivation and is super important for all of us, I think, to be more effective and efficient. And that's, you know, something that we're very excited about.
Yeah, a couple of things I just want to add. One is all of us on this call have been involved in the maker movement for a long time, and we have seen it change over time. So the initial rush 10 years ago was really around hobbyists. And then within a few years, it had really shifted to being an educational focus. And now many of the hobbyist makerspaces have closed, and the makerspaces that exist now are in educational institutions. And some major institutions of our global community, like Maker Faire, had sunsetted. And there are, you know, global brands around the maker community that had to close down. And so one of the things that I see in this movement and in our collaboration around this movement is thinking about what is the next era of the global local manufacturing movement. And it seems like it's one that's much more impact oriented, which we need, because with the global climate crises that are coming, we need this community to be able to pull together, to have these skills, to have these networks, to have that willingness to collaborate in order to address the challenges that are coming. And so the one other thing I'll say is a little bit of a call to action for all of the makers in the world to be willing, as much as you want to do it yourself, and as much as we love that you want to do it yourself, and we don't want you to stop that, to also be willing to do it together to some extent, to find ways to plug into your local networks, plug into your national networks, plug into the global networks that exist. Because by contributing your story into that whole picture, it better allows us to help the whole global movement be recognized and have the resources that it needs in order to really be able to have the impact that we know it's capable of. We know that all of you, all of us, are capable of really changing the world. But that requires resources, and it requires support, and it requires acknowledgement and recognition. So I'll end my part there.
Danny Chen makes a comment here from OSMS in Taiwan. He is asking this question about how, for example, our communities can cross-pollinate to some extent. How can they coordinate together? And to your point, Molly, I think as the first step, given that we know you all are can-do type of folks, even just providing a map of the ecosystem in terms of self-organizing regionally across these organizational brands, if you want to call them, or across groups, is an opportunity, like the very sort of step number one, I believe, in terms of what locals can do in terms of bridging the community gaps. Kevin, do you want to, we only have about 5 more minutes for questions, y'all. So if you have questions, please go ahead and put them in here. Kevin, do you want to go ahead and unmute and ask your question? Sorry, Danny, I took yours, but maybe Kevin might want to ask his question on video.
Yeah, thanks a lot, Sabrina. This is mainly for, I guess, other makers that have been, really concentrated on the local grassroots effort, if they've had any success connecting with the state government. It looks like, for the most part, the state government hasn't really been, they've been recognizing, but haven't been really looking at trying to provide funding to help establish these local makers, for the future second wave and even third wave. I'm not sure what the best way to go about is. For example, especially the products that we're trying to push to the hospitals, the big issue is that they're not FDA or CDC approved. And I guess officially the state government can't, recognize these products that, all hospitals in the state would make. The best success is just with the hospitals in the local region that are connected to these makers. So if anyone has any comments on that.
Yeah, I know. So I can speak a little bit to this because I do think there are some efforts and it gives me hope. In my state, I'm in the state of Maryland, which is where I live. There actually is funding specifically for manufacturing, and it actually does include makers. So several of the maker spaces in this region that are doing manufacturing of PPE have been able to get some funding from the state government. Now you might be like, okay, how did that happen? So I will tell you that some of it predates, and this is another reason why we need to be plugged in and together as much as we can. So right now we have the biggest case ever for why people should fund makers, right? Like we've done it. We have data, we have numbers, we have great stories, right? So I think it's really important, even more important, that the work of the coalition and the work of all of you, right, gets told, because those lawmakers now and the folks that are holding the purse strings can see what we tangibly can see what we actually can do. And so in Maryland, the way it happened was that a few maker spaces had relationships already with the state, had already been telling the state over and over again, this is what we do. The state's like, yeah, that's nice. That maker stuff's so fun, nice, and not really paying attention to it. And then when this crisis happened, they were like, wait, there are these people that keep talking to us about how much they can make. And so they inquired, like, what are you making? And the makers were like, we're making, let me show you what we're making. Let me show you the quality. Let me show you the safety that we're doing. So this particular makerspace, and I'll tell you, OpenWorks is one of them. And Will has been very open about sharing his experiences, but they actually were talking, trying to get local legislation actually done as work that they were doing predating COVID. So when COVID happened, it was very obvious that they were part of the picture. So it's a long-term strategy, and I know that's not what anyone wants to hear. I think everyone wants to hear, like, what's the quick thing I can say to my state that's going to flip a switch and make them give me money? It kind of doesn't exactly work like that in all cases. But I think one of the things that's hopeful is that there are state governments and local entities that are in fact interested in what we're doing. They can see what we're doing. I will also say that as you're making the case, and this is sort of wearing my advocacy cap, I've been telling people that we also should talk about ourselves and what we're doing in the widest swath. And what I mean by that is we're making masks not just for hospitals. We're making masks for homeless shelters. We're making masks for grocery stores. We're making masks and face shields and other items for nursing homes. And when you talk about prison populations, all these other vulnerable populations, your state is really interested in making sure that those people are taken care of. Those different groupings are taken care of. And if we take care of those people, then what happens is we offset the need for the hospitals. So the hospitals can get the pristine N95 masks. So I think it's also a bit of how we communicate what we're doing. And it's not perfect, right? There are states that are just unfortunately led by people who don't get it. And so we're just going to keep hammering on those people. But I will say that there's hope on the future and that some of the states are listening. Sherry has been talking to the National Governors Association. They're interested. The fact that we have a group of governors, even if it's not all the governors interested, is really, really, crucial. And then I know we're up on the hour. I want to just say, like, Edun, is doing some tremendous work. And Tom has been doing some tremendous work in trying to come up with a strategy that's appropriate to the United States that has worked really well contextually in other countries. And so he spoke a little bit about that, but that's part of why we're excited to partner with him in this coalition. Sorry, guys, I brought us to noon.
It's excellent. I mean, this is the beginning of a story. We're only, this is 10 weeks into this, 11 weeks into, at least in terms of the OSMS lifespan. I think we're at 10 weeks old.
If you guys want to continue a conversation, I'm going to make a cheap plug here that NomCon is coming up in a week. And so it's June 3rd through 6th. And we actually will be continuing this conversation. There is a session where we'll be revisiting this and actually talking specifically about the local and government response. So if you're interested in that topic, Kevin, I hope that we can see you at NomCon, and just go to nomcon.org. So sorry guys for my cheap push there for our conference.
It's a push for your conference for a session that we will all be on.
Exactly.
So I think it's allowable.
Okay, as long as you guys are okay with it.
Yeah, so we've been working as a group to come up with exactly a call to action for local governments based on the work that you've done and the Tom team have done So that's one of the strategies that we are really focusing our energies on as a group.
Great.
And I just want to say that in terms of our experience, there is a big change in mindset, which is super important, because conversations that we couldn't have 6 months ago, 3 months ago, we now can have. So it's now up to us, exactly, you know, to Molly's point and Dorothy, you know, we need to make sure that we have a coherent and strong strategy that we can implement.
Great. Well, I want to respect everyone's time. If others have questions, we might be able to follow up on them in the chat. Oh, and Jadon's giving a plug for upcoming session with Gidi, the founder of OSMS. And we'll look forward to sharing more on the evolution of this new coalition. Thank you everyone for joining. And this session will be available on the OSMS YouTube channel. So you can share that with your partners if you find that you want to forward this discussion on. Thanks everyone for joining. Thank you, Dorothy, Sherry, Edun, Molly. Have a great weekend.
Thanks,
Thank
everyone.
you.
Bye.
Enjoy more Maker Fair.
Bye.
Bye.
Yeah.